So let's have a quick chat about ankle arthritis, and some of the most common things people are searching for is, what is it and how do I know I have it? So here is one I prepared earlier. This is a very poor attempt at drawing the ankle joint. So what we have here, the tibia, the big long shin bone, and then the fibula, the bone on the outside of your leg, and then the talus, the bone that sits underneath those. And then collectively, then this is then known as the ankle joint. The bit of the pointy out bits on the side, they're your ankle bones that people say. So when you feel down the inside and outside of your leg, you come down to the foot and you feel some pointy out sticky bits. That's what we call technically your medial malleolus and then your lateral malleolus. So, like with any form of osteoarthritis, it's effectively narrowing of this joint space here, so loss of cartilage. What you may find is that, for example, here you get some narrowing of that ankle joint there. Now, with the ankle joint, it can technically happen anywhere. It can happen on the inside here, it can happen on the outside here, it can happen across the whole area. And sometimes what it is can be related to is episodes of trauma. So if we talk about how common ankle arthritis is on its own without any history of any trauma, it's not as common as, say, big toe arthritis or arthritis in the middle of the foot. So sometimes what you can do is, when you've had a nasty ankle injury, you can damage the cartilage and you just get little defects in the cartilage, which then it fails to heal itself. So going back to the previous video around big toe arthritis, it's not wear and tear, wear and repair. So it's failed to repair itself, and then you then get that narrowing the cartilage and you get what is called an osteochondral defect, or in simple terms, an OCD lesion. And that is most probably one of the most common causes that then follow into ankle arthritis later on in life. So if anyone's had an OCD or an osteochondral defect, sometimes you may have had surgery and they've tried what they call microfracturing. So I'm going off topic here, but sorry. So where they drill little holes into the bone to try and make it bleed, to try and stimulate the body to do that healing process. It's also commonly done further up in the knee as well. So how do you know you have ankle arthritis? Well, if we think about the ankle joint here, its predominant function is to allow the foot to do this and this. So what you may find is, with most people with ankle arthritis, depending on where it's at the back of the ankle or the front of the ankle, where the narrowing of the joint space is, obviously going up or down is going to aggravate. So walking uphill, downhill. Like with most arthritic pain, it's going to feel stiff in the morning. And what you'll find is, say, oh, I walk around, I warm up and it loosens up, and that's just the joint just getting warmed up, as it were, and allowing you to then go to your daily activities. What you may also find is actually uneven ground can aggravate it as well, because yes, its primary function is to do that, but part of the ankle will have, part of the will allow a bit of side-to-side motion as well. So you'll tend to find, if you're going on and you're going rambling, for example, lots of up and down hills, a lot of uneven surface, the ankle is most probably going to shout at you for that. And you also may find, if you do a squat down, you get to a point where it just stops, it blocks, and physically the ankle just can't move anymore. So sometimes ankle doesn't want to move up because of tightness in the calf muscles here. The big way to tell the difference between muscle tightness and bony impingement is, what will happen if it's muscle tightness, you'll be able to sort of bounce at the end of range of motion. You'll get to the ankle, if it's arthritis or any bony impingement, you and you just like hit a brick wall, and no matter what you do, you could sat and someone jump on your shoulders and put a load of weight and squat down, the ankle's just physically not going to move anymore. So to sum up, you normally find it's ache, it's stiff in the morning, particularly after activity, walking on an uneven surface, but particularly walking up and down hill, or even doing daily chores around the house where you may have got to squat down into the cupboard to get some cans out or something, you'll tend to find that will then tend to aggravate your symptoms. But don't worry, there'll be a video coming out in the future around about what you can do, treatment options available for you. Hopefully that is helpful, and we shall see you all soon. See you later. Bye.